Hello friends, today let's talk about infection after spine surgery and how to prevent it and how to treat it. Normally we see that infection rates after spine surgery even at a good spine surgery center is around 0.5% to 3%. Infection is an unfortunate event to happen after a spine surgery. Normally the infection can be either a skin infection or a subcutaneous infection, which we call as superficial infection, or it could be a deep infection spreading to muscles, fascia, or even to the bones. Or it could be an organ or a space infection, which eventually involves disc or vertebra or the epidural space. The most common organism leading to infection is Staphylococcus aureus. Now, let's talk about why the infection actually happens. Basically, sometimes it is related to OT environment and sometimes there are patient factors. When we talk about patient factors, there are multiple factors like diabetes is one of them. Infection is more common in obese patients or patients who have been using steroid for some reason, or people who are malnourished, or people who are smoking since long time. When we talk about surgery related factors, it could be because of long surgical time or greater blood loss, or post-operative drain can also be a potential source of infection. Infection rates are also higher in revision surgery or when we do multi-level instrumentation. So whenever patients are coming to us to have a successful spine surgery, we need to work on all the fronts. On patient front, we ask the patient to control the sugar well. If the patient is obese, we ask the patient to reduce weight if possible. Normally, we stop steroids 3 to 5 days before surgery and also for a variable period after surgery. We do CRP and ESR test, wound swab cultures to see if there is any potential infection that the patient is carrying. Also, we do urinary tract infection test to see if patient is having urinary infection. Also, before surgery, to reduce the infection rate, we use special disinfectants and antiseptics such as chlorhexidine to reduce the chances of infection and to make the operative area sterile. Also, we use disposable drapes for every patient so that the chances of infection or cross transfer of infection are really less. We are very particular about the antibiotic use also. So we give one dose 30 to 60 minutes before the incision, one dose when the patient gets admitted, and post-operatively for a period of 3 to 5 days we continue the antibiotics as required. All this together leads to lower infection rate in spine surgeries. However, sometimes due to unfortunate reasons or unfortunate circumstances, infection can happen. If infection happens, then it is best to take care of it at the earliest. Normally, we depend on a contrast MRI to see if there is infection. We try to tackle it as early as possible. It can be by way of debridement. Debridement is the cleaning process in which we debride the wound or clean the wound of infection. We put a drain to take out all the dirty blood, slough, or whatever passes there so that the source of infection is tackled. Also, we ask the patient to do strict sugar control. Our physicians, our endocrinologists and diabetologists help the patient in this process. We ask the patient to quit smoking. We ask the patient to eat high nutritional diet, especially high protein diet. And we do regular wound check and wound dressings and give appropriate antibiotics to take care of the infection. So if you are suffering from infection after a spine surgery, it is definitely an unfortunate event to happen, but it can be managed. So don't worry, see your spine surgeon and whatever best course of action he is suggesting you, do that and hopefully you will come out of this infection and you will have a successful spine surgery. Thank you.